For Nigeria, for instance, now, you want to know what kind of benefit package are you looking at? Because the benefit package will determine how much resources you need. Now, it's okay when we were talking about essential health services, okay, or basic health service, basic health package. But if you are going towards universal health coverage, you're talking about needed care. Now, needed care takes care of both the poor, the rich, everybody. That's universal health coverage. So the pool has to be of a sizable nature. And then when you consider that the taxation system in Nigeria is still growing, there's still a lot of learning process. I mean, it's very far from what you have in Europe. You begin to have an idea of the challenges that we have. And then you look at the issue of pooling. Okay, it's so fragmented now. You have all kinds of systems. The National Health Insurance Scheme is far from perfect. The coverage is very limited. It is focused on the formal sector. And then when you talk about procurement and strategic purchasing, it's a far cry from perfect. There's so much inefficiencies in the system. The World Bank did a study one time, and they found out that majority of workers in the health facility were not even health personnel. There was so much administrative staff. So you have a health budget that a lot is on recurrent expenditure, salaries, and little is going to the actual commodities and drugs. I think that the minister and the ministry, they're all putting things together, and they need the help of partners, because partners also must try to harmonize their efforts, joint programming, so that as much as possible, even though we're not doing a budget support, we can have some form of focused contribution towards the health sector in a way and manner that we can address what we have collectively agreed are the priorities. So for me, the key challenge in the health sector right now in terms of financing will be a form of cohesion. Collaboration, and coordination amongst the various resources, which is quite sizable, that's coming into the sector in a way and manner that the government can have a predictable inflow, okay? And against that backdrop, some form of accountability system, mutual accountability system, that you can have some fiduciary risk management of the overall portfolio. I think that way it will give partners more confidence in putting money in the system. It will help the government to know exactly what is expecting and budget properly. And then the people you have created demands for, when they go to the facilities, they will be able to get the required services, and so they are not discouraged. There are quite some achievements. We've just promulgated the National Health Act. National Health Act is a legal framework for all we've been talking about. It wasn't there before, so now at least there is a basis to demand for certain services. There's a basis to demand for equity. In that, the Act provides for what they call a basic healthcare provision fund, which is 1% of the national budget dedicated to primary healthcare services. I think this is a milestone. That's quite sizable for a country like Nigeria, just for primary health care. You have the national health policy that has been revised. You have so many other policy documents in the area of nutrition, in the area of social protection that are revised or being developed, and all of that. And most of these are costed plans. So you have all the materials in place. And then you have a critical mass of people who are willing to go ahead and do the necessaries.